Hi, my name is Schulte-Leech. I am a women's health physical therapist at Intuitive Hands Physical Therapy in Boulder, Colorado. I have worked with hundreds of pregnant and postpartum women, and I would like to help you, just like I did with them, have an easier birth and a faster recovery. To do that, I feel there are three areas of the body that really need attention while you're pregnant to help you have a better birth. And I'd like to share those with you today. The first area of the body I'd like to help you with is your abdominal muscles. There's an abdominal muscle called the rectus abdominis muscle, and that is the six-pack muscle that you see on, very few people. That six-pack muscle can separate and cause what we call a diastasis recti. You can avoid developing a diastasis by taking care of and protecting your abdominal muscles during pregnancy. I'd like to share with you one of the things that you can do to prevent diastasis in pregnancy, and I cover a bunch of other ones in my video, Protecting Your Body During Pregnancy for Easier Birth and a Faster Recovery. That video is available to you on my website. So the first thing that you can do is avoid any doming of your abdominal muscles in the midline. Have you ever noticed that if you lean back, you see this kind of tenting or doming of your abdominal muscles in the midline? That is the beginning, or could be, a separation of your abdominal muscles. And so the number one thing is to avoid any doming of your abdominal muscles. This keeps the strain off of those muscles and helps them to stay as together as possible. So the thing that you can do to avoid that is to actually contract your abdominal muscles and pull your belly button back towards your spine before you do any activities that may be causing that doming. So if you see doming, stop what you're doing, try to engage your abdominal muscles by pulling your belly button back to your spine and then doing the activity. If the doming continues, I encourage you not to do that activity anymore. There's also a motion that we do several times a day that, if we do it incorrectly, can really put a strain on the abdominal muscles. And I don't have time to go into it here, but I do cover it more thoroughly in my Protecting Your Body During Pregnancy video that you can get on my website. So please check that out, because the more you can keep your abdominal muscles together during pregnancy, the less work you're going to have to do after you have your baby. And believe me, you want your focus to be on your baby after you have the baby, and not so much on having to heal your body. So if you can protect your abdominal muscles and keep them together during pregnancy, then you'll have less to do afterwards. So the second area of your body that you need to prepare for birth is your pelvic floor muscles. Now, your pelvic floor muscles are what need to open up and expand to allow the baby to come on through. If you're carrying around a lot of tone in your pelvic floor muscles, that is going to make for a much harder passageway for your baby. I kind of think of the pelvic floor muscles as a stoplight, that some women are carrying around red light tone in their pelvic floor muscles. And the thing is, they have no idea that they have that much tone in their pelvic floor muscles. So those women, those babies are going to have a harder time engaging into the pelvis to start childbirth, and they're going to have a heck of a time getting that baby out too, unless you learn how to relax those pelvic floor muscles. So there's also yellow light tone, which is just a little bit more tone than normal, and that's just going to make it, again, kind of like a warning, cautioning, baby, it's going to be a little harder coming through. And then what we really want is green light tone. We want muscles to be able to expand and to stretch out so that the baby can come on through. So I have written a blog post. It's Caring for Your Pelvic Floor After Childbirth, but in there it talks about vaginal massage. And I really encourage you to do some massaging to your pelvic floor muscles. Some people call it perineal massage. That's great as long as you're checking out your pelvic floor muscles and making sure that they can relax. It's amazing how many women walk around with, kind of like you have that tone in your shoulders up here, that same kind of tone, you walk around and you don't realize that your shoulders are up to your ears until you're like, oh, wait a minute. That same thing can happen in your pelvic floor muscles. We want to make sure that they can relax to allow that baby to come on through. So the third area of the body that needs your attention prior to birth is your pelvis. And if you are having any low back pain, some practitioners just kind of shrug it off as, oh, well, you're pregnant and back pain's a common thing to happen. But actually, pain is the indicator that there's a dysfunction going on. Something's not happy in there and it needs your help. If it's your sacroiliac joint, that could make your birth more challenging. So if you are having low back pain, really make sure that you get your sacroiliac joint checked out by either a women's health physical therapist or a Webster trained chiropractor. Because here's your pelvis here. And the sacrum, this is the sacrum right here, needs to do two motions to allow the baby out. The top part here needs to come backwards. It needs to move backwards here to open up this inlet to allow the baby in. And then once the baby's in, it needs to do the opposite motion, which the tailbone then comes backwards to increase this outlet to allow the baby out. So this motion all happens here at your sacroiliac joints. So if this can't happen, then it's going to make for a much more challenging passageway for your baby. So really get any low back pain or any issues with your sacroiliac joint checked out before you go into labor. I also have a 4 steps for easier birth document on my website that you can sign up for, and that will be delivered to you via email. And that gives you a couple of different stretches you can do to help open up your pelvis and make for a wider birthing canal. So that's on there. And then also, again, I cover those stretches on the video, protecting your body during pregnancy for easier birth and a faster recovery. So I wish you the very best in your pregnancy and also with your birth. Good luck.